Hello, and welcome to the Strength and Simplicity Pelvic Health channel. I'm Sumeeta, a physical therapist, and I'm here to share some simple science based strategies to help you move with comfort and confidence. Today, we're going to talk about tailbone pain, which is also known as coccydynia. This type of pain makes it really uncomfortable, especially with sitting. The good news is that we have simple strategies, and one of the biggest is how you sit. Think of the tailbone like the tip of a pencil. When you push the pencil straight onto the hard surface, all the pressure comes to that sharp tip of the pencil. That's how the tailbone works. When we sit on a hard surface or lean backwards, the body weight presses just right at that small bone. That's why it hurts more when you sit for a longer period of time, but it feels better when you stand or walk around. To help with this, there are seating and cushion options. A cutout or a wedge shaped cushion has got an opening at the back. So think of it like the tailbone having its own parking spot so that it does not get squashed. And then the weight gets shifted forward onto the legs and the sit bones. A rolled towel or a wedge under the sit bones can also be effective because it tilts the pelvis forward, lifts the tailbone upwards, and thereby relieving the pressure. Another option is the donut cushion. Imagine sitting in an inner ring tube. The whole takes the pressure off the center. Some people like it, for others, the edges may dig in. I think it's worth trying, but not always helpful. And then avoid extremes. So not too soft, not too hard. If it's too soft, you are again sinking straight onto the tailbone. If it's too hard, it's like you're sitting on a rock. So medium firm is usually about right. When you sit, try leaning slightly forward. So picture yourself carrying a small book, upright and tall, but not pushing it too much. You sit with your feet flat on the ground to give you some stability. And when you stand, you push through your legs and use armrest if available so that you don't rock back on the tailbone. Even with the best of the cushions, if you sit for too long, it is going to get sore. So it helps to get up, stretch, and then walk around every 30 to 45 minutes. The really encouraging news is that 9 out of 10 people with tailbone pain respond well to conservative interventions. That includes physical therapy, the use of the right cushion, posture, pacing, and regular breaks without having to undergo anything invasive. So, to summarize, you take the pressure off the pencil point, use the right cushion, sit slightly forward, and take regular breaks. I hope these tips can help make your sitting a little bit more comfortable for you. Thank you for watching. This is the SIS Minute, where there is simplicity in action and strength in movement. Namaste.